And it's really great to be here. Oh my gosh, this is amazing. And I learned a lot about the work that you all do just by being invited to come here. I'm curious how many people know who NAMI is or have ever worked with NAMI. All right, that's great. Okay, we're making progress. I'm so glad because NAMI is a national organization that has 650 state and affiliate organizations around the country, and we have a lot of free resources. So I would say if you don't know us, please get to know us. You can visit NAMI.org. Everything is free. We give it all away. And we would love to have you really take a look at our resources and think about them as you're engaging at the community level. I think Dr. Murthy said so well what we all are so worried about, which is we have a real youth mental health crisis in this country. And actually, we have a crisis not just among youth, but among young adults as well. So the 18 to 29 age group has also experienced very high levels of anxiety and depression, and there's a lot happening, very, very big concerns around suicide and growing rates of suicide, especially among youth of color. Very, very concerning that they are finding that as the only way out from what they're experiencing. And I was reminded in London near Hyde Park, they did this exhibit where they showed, sadly, pictures of people the day before they died by suicide, and they were a very high percentage of them were smiling and looked as though they were on top of the world. And so it is so hard to know when someone is really struggling. These are the conditions that can be silent until they really have the worst imaginable outcomes. So it's just such a reminder that at the community level where all of you work and do such important work, there is a huge opportunity to really be having conversations in different ways. And having done a lot of work on workplace mental health, and especially through the pandemic, and having conversations with big corporations who were very worried about employees who struggled a lot, we talked a lot about how checking in looked very different. So it's not sort of the, hey, how are you, and then moving on. It's really taking a moment to say, how are you doing, and how are you really doing, and just pausing. And what we found was a lot of companies were really interested in helping managers understand that it's important to also show some vulnerability. And there was a lot of conversation about how vulnerability was becoming the superpower among some corporate leaders, and those who really engaged in being open and honest about their own experience with mental health concerns or the experience of loved ones or people, friends or family, that they were really able to have people open up and feel like it was safe, because leadership really sets the culture. So whether you're a leader of a corporation or a community organization or a leader within your family as a parent of kids, it's really about checking in in different ways and starting to feel like we can melt the stigma away. And I think Dr. Murthy has been tremendous around isolation and loneliness and recognizing that we have an epidemic in this country of people who feel really very disconnected. And even when they may be in a group of others, they are still experiencing loneliness. And we know that loneliness can be directly connected to people experiencing depression and anxiety. So I know we have a great panel coming up. I just want to say a few things about, well, what can each of us do when it comes to really thinking about mental health? One is, I think, to learn more about the signs that you may or may not see. We don't always see them because it's very easy to hide when people are experiencing conditions of mental health. What we know is that half of all lifetime cases of people who experience a mental health condition start by age 14. So half of all lifetime conditions. And these are conditions of young people. And 75% start by age 24. So it really sort of frames up that we have to really be thinking about young people in community. The other thing is what we know is only half of people, less than half of people who experience mental health conditions are identified and receiving any source of support. So we have a long way to go for people to feel safe and like there's help available and to know where to seek care. So it's very important to recognize that we have a long way to go so that everyone is identified who is experiencing these conditions. And I think each of us can learn more about what are the early warning signs, how do I start a conversation, how do I think about my own self-care. We know burnout is at very high rates in workplaces across industries. In the nonprofit sector, in the for-profit sector, burnout is a huge concern. And what we know about burnout is it results from excessive stress. And excessive stress over long periods of time can absolutely lead to people experiencing depression, anxiety, and substance use. That connection is real, and it's been well studied, so we have to really help fight against burnout. And the way we do that is have conversations, engage in self-care, learn more about mental health, really support each other. At NAMI, and this was said earlier, we say you are not alone. And that's our mantra. And it's the work we do, too, at the national, community, and state level can be really hard at times. I mean, people can have really devastating conditions. And sadly, in this country, a lot of people end up homeless, in prisons, in jails that experience the most serious conditions. So there's a lot more we can do to help identify earlier. It's on average 8 to 10 years from the onset of symptoms to intervention. That's research from the National Institute of Mental Health. We have to close that gap if we really want to get serious about lessening the severity of conditions. So a lot to do. NAMI has a lot of free resources. I would really encourage you to seek out not only the resources we have at our website, but in community. There are helplines, there are warm lines, there are support groups, there are education programs. There's so much more, and those are all free because we are very intentional about providing these at no cost. So navigating mental health care is hard. If you've ever tried, you know that. And we constantly are working on that. I would say we are at a moment right now. We have the White House, we have Congress, we have governors. There is a recognition that we all have to come together and do more. The last thing I'll say before I invite up our esteemed panel is, I hope everyone knows about 988. This is the new 3-digit number. It's the mental health crisis line. It was modeled after 911. So we are building out the services in community that are needed for crisis response services so that the police don't have to come every time someone's having a mental health crisis, because we know tragedies result from that. But I just want to make sure that everyone knows about 988. And we at NAMI have a commitment to continue to build out the services that are needed so that we can make sure when people dial that number, they get a compassionate, empathetic, and professional response from a clinician and clinical care professionals. So I am done with my remarks. I just want to say thank you, because what we know about staying mentally healthy is the importance of social connectedness, community connection, that one adult in a young person's life can make all the difference when it comes to their long-term outcomes. And I think Sarah really talked about what it meant to her to be involved, and that so personifies what we know exists around purpose and meaning and feeling valued as an individual. So kudos to you all for the great work that you do. So I am going to invite up, we're going to have a conversation with panelists about the work they're doing in community, and I am privileged to be able to ask them great questions that have been developed. I would like to first invite up Lori Godarov. I know, I was going to say, I hope I'm saying that right. Lori is the executive director of the work group in Camden, New Jersey. Welcome, Lori. Also, Leah Mattel, who's the executive director of the Vermont Youth Conservation Corps in Richmond, Vermont. And then also Deirdre Wright with the Environmental Justice Corps in Buffalo, New York. And I have a big shout out to upstate New York because I grew up in Rochester, so very happy to have Deirdre up here as well. How about if you tell us a little bit about yourselves and your core and the characteristics of your members and your geographic locations. And we'll start with you, Deirdre.
Okay. Hello, everyone. This is my first time in the Core Network conference, so I'm like, yay. Deirdre Wright, I'm in Buffalo, New York. Yes, there's snow on the ground, but there's also snow in Colorado. Somebody told me that, so I'm not the only one. And I have been in workforce development and programming for over 20 years. And I'm really passionate about what I do with program development and people development. The core is made up of 18 to 30-year-olds. It's workforce development. And I am super passionate about our connection and partnership with Power Corps Philly. They are our technical advisors, and we have a relationship with the Buffalo Sewer Authority, and there the members learn stormwater maintenance, or what I have to say is it looks like landscaping, because otherwise they don't know what it is. And I appreciate being here. Yeah.
Great, thank you. I'm Leah Mattel. I'm from Vermont Youth Conservation Corps in Richmond, Vermont. We also have snow on the ground, I believe. I've been at VYCC for 3 years through a path that brought me to being able to pay our participants for all the things that I've been passionate about in my career, which has been sustainable agriculture, conservation, transformative education, and all. It's amazing to be part of the Conservation Corps, which I had my eye on for years, but only moved over 3 years ago. We are a big corps in a small state. And it's wonderful to be in Vermont, where a lot of folks are really passionate about VOICC's work and our work in the community. In a lot of ways, we're a classic rural state corps. Our conservation program has 4 different components: water quality, forestry, carpentry, mostly in state parks and trails. But we also have a unique food and farm program, which is about 1/3 of our core members, a day program. Most of our conservation side is camping. And we partner with area medical centers who identify patients who face food insecurity and diet-related illness, and who then the medical centers purchase weekly vegetable and sometimes chicken and egg shares from us to distribute to their patients. So our core members get to be part of that pretty inspiring program. And prior to VYCC, I worked at University of Vermont, where I had even closer proximity to mental health challenges with students. I really believe that we're all in the work of inspiring young people, but also really in suicide prevention work, whether we realize it or not.
Hello, I'm Lori Godorov. I am the Executive Director of the Work Group and New Jersey Youth Corps of Camden, and now under the umbrella of our organization, a mental health agency, which I will talk about in a few minutes. We are a classic urban opportunity youth program, 16 to 24, out-of-school youth. We are in New Jersey, just outside of Philadelphia.
Very nice. Okay. We all know that young adults may experience crises from time to time, and sometimes their resilience is influenced by their preparation prior to the moment of crisis. So, how is mental health and wellness integrated into your program model? And let's start with you, Lori.
So like many of us, for a long time, we tried to figure out how to address mental health, and it just wasn't working. And now we are at a place where clinical mental health, behavioral health, and substance use services are part of the fabric of our Youth Corps program. They are woven into our WIOA services. To do that, we became licensed as a mental health provider. And so we tried to partner, we tried to figure things out, but it doesn't work when you have a young person sitting with you who opens up, who feels safe, who pours their heart out and say to them, oh, thank you so much for sharing. Now I'm going to send you to a place where you've never been, with somebody you've never met. I've never met them. I don't know how long the waiting list is. I don't know how you're going to be treated, but go there and open up and tell them everything. And so we knew we had to bring it home where our kids felt safe. And so I will admit, I resisted this for a lot of years. I thought, I don't know how to run a mental health agency. But remarkably, running a mental health agency is no different than running any other kind of agency. And so we embarked on becoming licensed to do behavioral health and substance use, which then allowed us to unlock Medicaid funds, which all of our students qualify, almost all of our students qualify for. And so then we could hire the clinicians that we wanted. They are embedded in daily life. So our therapists are part of our morning icebreaker activities. They are part of things that happen. So for our students, they may just go have lunch with a therapist. They may go play pool with, but it's part of their day. They don't have to stop. They don't have to go someplace else. They don't have to make it a separate activity. And so that's for individual and group. And so it has now just become part of their whole core experience. And it was a process to get there. And it's also, aside from being really good for the kids in terms of accessing services, it's a really good business model and super profitable. So I can talk more about that, but.
Wow, that is so impressive, by the way.
So wait, let me just say one more. So,
yes.
Okay, this is the really cool part. So we became licensed. It took about just under $200,000 of startup money to get us going and built and licensed. The licensing application was just over 500 pages, one ream of paper. We hired somebody to do that. We became licensed in November of 2019. The world shut down in March of 20. We subsidized it for the first 2 years. In fiscal year 2022, the counseling center was fully self-sustaining and generated a $44,000 surplus of unrestricted revenue back to our education programming. So it's great for kids. It's great for the organization.
Yeah, I just want to say very quickly, I love it. And the reason I love it is the disconnect so often happens between when someone exhibits and is ready to receive care and when they connect. What happens is they get referred, and then the referral never materializes. So I love that idea.
And you don't know who you're referring to.
Yeah.
I handpick all of the therapists that work with our kids. And they are people who are aligned with us culturally in our approach and are steeped in youth development. And so I don't have to refer them. I had a kid have a meltdown in my office last week. And I said, can I call Miss Amy? And I literally held his hand, and the clinician came in, and we just sat, and the three of us talked, and now he sees her on his own.
Love it. Thank you. So impressive. Let's go to you, Leah.
So that's like amazing and so different than ours. We really try to integrate in all aspects, in the proactive realm and the reactive realm, in our training. And so starting with before core members come to us, we've done a complete overhaul of our website. We have a lot more understanding in our position descriptions and in our videos. Like we don't want people to know, but we do want people to know that it is buggy in Vermont, and it rains sideways a lot, and the lean-tos are a long walk from the parking lot with your stuff, and you're gonna be hiking in materials, and you're gonna be with a group, and it's an intense environment. In addition to all the amazing, inspiring components that we all know, but part of it is just, I've been trying to think of like, what's the equivalent of breaking in your boots, but mentally before you get there, and having that sense of like, what's it gonna be like, and what are, mentally, and in terms of being away from my regular community, and in this new community, we know the bonds that our core members make in their new communities, but they don't happen yet, right? There's that breaking in period, and there's that being away from and being, the newness. So part of it is in our materials, so folks know what they're getting into. During our training, we have an interplay of physical health and mental health preparedness, and some of that is around building inclusive communities. Some of that is around how to have hard conversations and give feedback, and some wellness techniques that I'll tell you a little bit more about our licensed clinician who works with us, but what are some wellness techniques? What are some, even just stretching and breathing and some of those mindfulness practices that can be integrated into the day? Ways in which to check in with each other, that check-in. I really appreciate you bringing that up. We also have a licensed clinician who works with us, and she is not on our staff, but she's a direct partner of our program. We worked with a larger agency that closed down, unfortunately, last year, and so we're rebuilding that network with the licensed clinician who has a background in wilderness therapy. And she meets with all Corps members during training, so they know who she is, they have her phone number. She works with crews during training on a workshop we call Wellness and Resiliency. And she meets with Corps members out in the field as well. So she'll visit a crew, work with the entire crew if that crew is having trouble with certain dynamics, or there are certain members of that crew that are struggling. She'll meet one-on-one or give the crew some techniques and practices. She also can coordinate a continuance of service. So we're in Vermont. A lot of our crews are out of cell phone service for a good amount of the season. And a good third of our program is on our campus with our food and farm program, which is actually, you get cell service in our campus. So that's a unique thing sometimes in Vermont. So she'll come every single week and meet with folks in our food and farm program and be available. Some meet with her regularly and some by exception. But our crews that are in the field come back on the weekends, and that's a new model for us, our camping crews. So there is a touch point on Fridays and over the weekend and on Sundays. I mentioned earlier that she can coordinate some continuation of services. So it can be hard for a Corps member to have their sense of like, what is my schedule and how would I maybe connect with the person I work with at home if they have somebody, or a trusted person at home, and so it helps them to understand how that connection could work. And we have a long way to go. So right now, I've been checking my email like 5 times a day to see if we received a grant that's going to help support this person's work over the next 2 years, because that work used to be subsidized a bit more by the state. But we have a long way to go, and we're really integrating this program into some future models. But a lot of it is around how do we take the mental health piece and the physical health piece and integrate those practices? How do we look at them? I'm a long-time wilderness instructor and really comfortable with all the first responder things of like how to assess a patient and rate your pain and talk about the quality of your pain and what makes it worse. What makes it better? What's the equivalent of hydrating? And we shouldn't have heat emergencies because we can work on the preventative end. And so how do we have all of those different scale practices on the mental health level of talking about pain, but also what's the equivalent of tick checking on a mental health level? What is all those preventative techniques and around wellness? And we're really just starting to develop that suite.
Oh, that's fantastic. And the prevention and thinking upstream is so critically important. So thank you for sharing. That's fantastic.
Okay.
Deirdre?
So our Corps is just 4 years old, so we're newbies. And when we started, I don't have a mental health background. I was getting a lot of information from Power Corps Philly. I'm like, okay, got to do this, got to do that. The power circle in the morning of scale of 1 to 10 and the feeling wheel with the feeling words, they all hate it, but it becomes like this thing that they cannot live without. With that said, I want to fast forward and tell a story. My first Corps, we were out in the field, burning hot, no shade, asphalt concrete jungle, because we're out with stormwater maintenance on the tree pits on the side of the road. And everything was going fine, and one of my members was standing next to the van crying. I'm like, okay, I don't know what to do. Panicked, like, what do I do? So I call somebody who does have a background in mental health and wellness. I'm like, what am I supposed to do? He's crying. I'm not sure what's happening. And the person asked me, well, what's happening right now? And I said, well, the other 2 are trying to console him. And he said, okay, you're good. Bye. Like, what do you mean? So I didn't realize it, but I had created a collective space for healing. So then I had to kind of do that thing where people do when they have strategic planning and think backwards. Like, what did I do? So I had to remember and take note that we have icebreakers, and I create a vulnerable space for them without doing it on purpose. There's trust, and there's comfort, And when we had our community agreements, I didn't say, okay, we have to do this and we have to do that. We did that together. So they were a part of that sharing and creating that community space. We have what's called a garden. So we draw a big tree on flip chart paper, and then I have them place Post-it notes all over the tree as leaves, and those are the things that they want to do or they want to accomplish or they had a dream about and they never got a chance to do. And then I add some stuff in there like some park that they never heard of. That is their space of hope. So now they have, like, man, we came up with this thing together and it's not corny and we can share it. So for me, because I didn't have that background of getting a licensed person, I just created the healing space of like that, we can do this together. And then I had to figure out, oh, I gotta hurry up and get this mental health professional. So now we have them and they meet every week and they work on SMART goals and they make sure they're checking the marks, and we have our data and our reporting, yay. But it all started with me freaking out because one of my members was crying and I didn't know what to do.
So I love that. And a story really brings it to life. So
Yeah.
that is great. And kudos to you for realizing that you were already doing the right thing, right? So Deirdre, we're going to stay with you. And at Environmental Justice Corps, you use the social determinants of health as a guiding philosophy for engaging with your members. How does that influence the way you do intake assessments and other in-program services?
Okay. So for those who may not know what social determinants, so it's the social factors that keep us healthy, or that should keep us healthy. So you take two people, same age, same everything, and one lives in a gated, wonderful community that's safe and you can jog and run and do whatever you want. And then there's the other person who lives in a neighborhood like I grew up in, where you do not jog and play and do whatever you want. So when we design our intake assessment, each section represents a different social determinant of health. So how's your food access? What is it like? Do you feel safe where you live, work, and play? How is we didn't initially ask the mental health question because that wasn't something that I could address. We would ask about, do you have a family doctor? So those are all the things that we ask in that assessment, and we use that tool throughout the entire time that they're with us, so we can see, where are we? Are we thriving in that area? Are we capable in that area? And with that, we design the program around it. So if we have an activity around food, it's not just, okay, we're gonna go to the supermarket and we're going to look at the label and we're gonna have a cooking class. We're also gonna go to a food pantry and we're gonna understand that some people, this is what they have to do. Or we're gonna go to a worm farm and learn about composting, which is really gross, but it's great. Or we will go and have a Pilates instructor and teach them about how everything works in the body together and why it's important for you to continue moving. So that's social determinants of health is what we need to stay healthy. So if your doctor tells you have high blood pressure, here's a pill, but if you're still broke, you're still gonna have high blood pressure. If your doctor tells you have high blood pressure and you have to go home and you're couch surfing, you're still gonna have high blood pressure, or something else for that matter. So that is how we kind of make sure, as we have that garden and all those things that they wanna do, how do we maintain that healthiness for them? How do they understand that no matter where they go, when they get that job, now they have that pathway, they're making more money, but if you're not understanding that it all works together, that ecosystem in your body, then we're not addressing everything.
That's fantastic. And actually, we're hearing a little bit more about physicians who are prescribing, like, you need to get outside and do X number of exercise, like walking when it's safe and you live in a community where that's something you can do. But we're finally starting to see the medical establishment catching up with the idea that it's mind, body, and we need to address those issues like exercise and food and our lifestyle and social connectedness and other things, which is fantastic. So Leah, we understand that the Vermont Youth Conservation Corps has been able to hire a licensed social worker as part of your regular staff. What does that interaction look like for members who participate in the immersive camping experience the Corps offers?
Sure, and I touched a bit about this in
Yeah.
the last question
Yes,
because I
you
got
did.
a little wordy. But she's not a full-time member of our staff. She's someone we contract out to, and we're looking to expand that relationship, as I mentioned. But she really supports our core on a number of different levels. So on the highest level, helping with training of our staff, because it's our coordinators and our field supervisors who are really directly supporting our crew leaders in the field and the ones that are taking the on-call calls after hours. And so some of the steps and some of the how do I have this conversation and where is that emergency flow chart and how do we assess where somebody needs more help and what that help looks like. She's not emergency support, so she's not the equivalent of 988 and not on call 24/7. Those services exist and they're really robust. But able to connect with people after some time and able to connect with staff to help give some resources. She primarily ends up meeting with crew leaders and our leaders on our farm, who are the ones that I imagine there'll be a lot of head nodding that, we're finding that our leaders are worried about themselves, and they're worried about their members, and they're worried about the planet, and they're worried about social justice, and they're just carrying all of it, and there's a lot of anticipatory worry as well, like what's it gonna look like to be on all weekend, or what do I do if a member is really struggling and it's Friday afternoon, and what do I do if I need to come out of the field? And so she's available to have some tools, and those tools are on multiple scales, and sometimes it is the right call for someone to come out of the field, or sometimes it's just integrating some of those practices so she can give them direct practices. A big shift that we just made this year, it's brand new, we're gonna start it in June, is that all of our conservation camping crews are coming back on the weekends. That's after several years, but specifically since the pandemic, hearing our crew leaders just say, it's too much to be on all the time. That's probably one of our biggest programmatic pivots, is that our crew leaders are off, all of our camping crews. Vermont's small enough that nothing's more than 3 hours away. It's different than those of you like in Oregon and Montana, I know. But all of our crews will be back 4-ish on Friday, and that travel's integrated into their project work that day. And some will be camping on our campus, and some live in proximity to our campus or head out and do other things on the weekends. And that ability for our crew leaders to be off, I know I'm not answering your question.
Yeah, no, you are.
Totally
That's
different.
great. It's okay.
It's realizing that right now. But that ability for our crew leaders to be off on the weekend and not only not be on, but not worried about being on week after week after week is a really big shift for us. Our summer leaders last year came in with so much worry about how am I going to take care of myself while taking care of my crew, while worrying about all the things in the world that I come in worrying about at the same time. So that also brings all of our camping crews, our conservation crews, back to our campus for that touch point where they can meet with our clinician, Abby, and we're expanding that group of people. Our campus crews, our farm crews that are on our campus, they have that constant proximity to our full-time year-round staff, and that doesn't mean that folks don't need also support, but it's easier to find it, and they're not so remote, and they have more than their crew leaders as support services day after day, and really hour after hour, so that looks very different for them.
Yeah,
how's that for not answering your question?
No, that was really great. And I think the idea of the level of engagement that you're seeing is a sign that you're doing the right thing, right? I mean, it's like if you offer a service and support and people use it, it's such a sign that it was needed to begin with. And I think that's a great thing. Which
is why I'm waiting for that grant to expand it.
Yes, I know. I hope it comes through, actually.
Access Medicaid
I
funds,
know.
you don't need a grant.
Yes.
I know.
It's there forever.
Look at that connection. I love it, for sure. So let's go to Lori. And I wanted to ask about trusted relationships, that they're a critical feature of the core experience that makes your approach to youth development ever more impactful. In what ways does your program use this to support members during and after the program?
So I want to add, before I answer your question, one piece that I forgot. Okay. So we also have psychiatric services. So we have a psychiatric nurse practitioner paid for by Medicaid and other funds. So for our core members who do need access to medication or medication monitoring, again, they do that at home.
That's great.
So back to your question. I mean, I think like all of us in the core world, what we do is, better than anything, is we build trusting, safe relationships with young people, which is why, as I said, after years of resisting, I finally broke down and said, we have to do this because it's where our kids feel safe. And so by becoming our own provider and having those services, we can broker that relationship. So if I'm sitting with someone, as I was last week with this young man, I can say, let's do this together. We have a network of alumni who access our services. For them, it's coming home. And so our students begin, everybody sees a clinician at least once. They don't have to continue with therapy if they don't want to, but it's there, they're enrolled, they have access to it while they're in the program and beyond. And so now a few years in, we're starting to see kids who either continue with it after the program or come back to it. They may see a therapist for a little bit, be okay, and then 6 months or a year later say, hey, I need to come back. And it's because our kids feel safe with us, because of that relationship, that they feel safe, and we've removed all the stigma and barrier. They don't even realize they're in therapy. They're just like hanging and playing pool with Mr. Casey, or they're having lunch with, you know, Miss Amy, or going to talk to Miss, but it's not therapy. And it all stems from that relationship. And now through Medicaid, there's tons of other money. We're getting opioid lawsuit money. We're getting, there's lots of state and local money. And the really cool thing about substance use prevention money, I know this isn't fully your question, but
no, this is good.
Substance use is youth development. Substance use prevention is not like don't do drugs. Substance use prevention is anger management, self-esteem, decision-making, all the stuff that we do in CORES anyway can be a substance use prevention activity, and Medicaid pays $45 an hour for substance use prevention instruction. So the things that we do in our orientation, like the equivalent of, what does Youth Build call it, mental toughness, that first phase, if we have a clinician in there, we can bill $45 per hour for every individual who's in there, because it's substance use prevention. So it's the stuff that we're doing in CORES anyway. We've been able to elevate to clinical mental health services and psychiatric services.
Yeah, so that absolutely is important information, because much of the time in the mental health substance use world, it's like, how are we gonna pay for this, right? We don't make it easy, so the fact that you found ways to make it work is so impressive.
Or there's a grant, and then the grant goes away, and then there's a gap, and
exactly.
Is somebody gonna pay for it? And there's enough kind of a buffer, so for our kids, we don't take any private insurance. We could, we just chose not to. For the few who don't have Medicaid, there's either funding for individuals who don't have insurance. If they have private insurance, there's enough kind of slack in the system that we can afford to see them without billing for them. So everybody can be seen.
That's great. I mean, the trusted relationship piece is so essential, and I love the way you've integrated it so it just feels like it's part of the program. And it's familiar faces and someone you've been engaging. It
happens during their day. They'll step out of class, they'll go to lunch, whatever. It's not something extra they have to do, another place they have to go.
How about you, Leah? The trusted relationships piece when it comes to mental health and well-being and relationships and more.
A lot of that starts in our training and starts with, you know, our licensed clinician comes in and meets all of our crews so that if she's out in the field and somebody's accessing that service, they know who she is. Yep. But depending on I talked about the food and farm program where there's that proximity to full-time year-round staff and specifically our farm staff as well, is there are multiple touch points. There is that integration of that community building, that relationship building piece all throughout our training, all throughout just even circling up in the morning. And I'm sure we all have many of these rituals where it's outside of the project work and that building community component and building off of that. Our camping crews, our conservation crews also, their training is, a lot of it's in that proactive space on How do you lean into difference? How do you have some of those hard conversations? How do you ask open-ended questions? How do you recognize when we've departed from dialogue and can back up in the conversation and find that place of affirmation and common ground and return to that healthy dialogue space of listening? A lot of what you talked about reducing the stigma and talking about challenge, ways in which to talk about it. Yeah, for our crews that are immersive, they have 2 different staff members who are visiting them regularly also, so it's not all on the crew leader, of course. We all have that model in some form. Somebody who's more project focused and somebody who's more of a supervisor focus, and our members are, it's very explicit to them that they can talk to more people than just their crew leader, because that might be where the challenge lies as well, is in that relationship. So knowing that they can come outside of that and talk to multiple staff people who they have regular touch points with. And then with this new schedule I've mentioned to you all, that will give them multiple touch points on our campus on Friday afternoons and on Mondays. And so having that regular touch point with all of the conservation staff, for example.
That's great. Excellent. And Deirdre, how about you with trusted relationships?
Yep, so we actually start before they're enrolled. So during the phone screening, one of our partners is here from the Service Collaborative, our local AmeriCorps programs. So they're enrolled as AmeriCorps members. Prior to that, there's this list of stuff that they have to get together. And when I call them to do the phone screening, I start off with, you know, name, address. I just want to verify this is what the program's about, blah, blah, blah. And then we want to know if they are in need of health insurance. So normally you do not ask that on a job interview. That's none of our business. So I preface that and I say, okay, so this is how this normally works. No one should be asking you this. I am asking you this because if you don't want to answer, you don't have to. Just me saying that, that builds trust. And then from there, throughout the program, I'm always trying to let them know, we are always trying to let them know, this is what is okay and this is what's not okay. So when you leave us, you're going to be applying for this, filling out that, you're going to be sitting in interviews. They should not be asking you this. It's okay for them to ask you that. And then the rest of it, I kind of cheated and I called my members, which is great because I can reach out to them like that. So our alumni network is really strong. If I ask them almost anything, they'll show up for me. And that shows, I'm like, wow, they do trust me because I could do that. So I did ask them, like, so how did I build trust with you guys? Like, what did I do that made you want to trust me? So one of them said, because you didn't pretend like you knew everything.
Oh, that's great.
It was okay when you said, you know what, I'm not sure, and I know you need that, but I'm going to go and find out. Another person said, you always try to figure out a way to give us what we needed. So someone needed health insurance. Someone sucked at public speaking, they were terrified and they wanted to get better. Someone wanted to find out about a field that none of us knew anything about, but we went that extra mile. So when you say, I'm gonna meet the members where they are, then you need to walk that talk. You need to put in the work and you need to do what you say you're gonna do. And if you can't do it, you need to be so honest with them all the way through and be consistent and let them know I'm a human being and I get tired when I leave here. But I'm gonna call you when I can and I'm gonna follow up when I can and I'm gonna do what I can to help you out. So I think when they see the human in you and when they see that you're putting in that work, that builds that trust.
That is so great. I love meet people where they are. That's another thing we say at NAMI. That and you are not alone. So that is awesome.